Welcome back to a Pediatric Dentist channel, Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my previous videos. Today we are going to cover a small but important topic, which is role of maternal anxiety on child in dental operatory. Maternal anxiety is a critical psychosocial factor influencing a child's emotional and behavioral response in the dental operatory. So to prove this connection, Bell proposed one-tailed model. Bell proposed that the parent-child relationship is unidirectional, with parental characteristics exerting a dominant influence on child's development. These include shaping the child's personality, anxiety levels, stress responses, and behavioral patterns, especially in unfamiliar or stressful environments like dental clinics. Then why mother? So mother, because with mother the child has a combination of biological, psychological, and social factors. Mothers typically begin bonding with the child during the prenatal period through hormonal, emotional, and physical changes, and also she is a primary caregiver. Bailey and Schaffer classified maternal attitudes into distinct categories, each associate with the specific child behaviors relevant to dental settings. So if mother is overprotective, mother shows excessive care, avoidance of risk, infantile dependency. Infantile dependency refers to a psychological and behavioral state in which a child remains overly reliant on adults, especially caregivers, for emotional support, decision making, and basic functioning beyond the age when such dependence is developmentally appropriate. So the child might behave submissive, shy, anxious, may show temper tantrums, but not fear of new environments. Means in case of overprotective mother, the mother must be very caring, always watching over the child, avoid letting them take risks. So the child may be shy, quiet, and nervous in dental clinic, might throw tantrums, but usually isn't scared of a new places. If the mother is overindulgent, then she grant all desires, spoils child. She give the child whatever they want, a lot of toys, sweets, attention. So the child might shows aggressiveness, demanding, poor emotional regulation, and difficult to manage. Child may be spoiled, demanding, and hard to control. They expect things to get their way and get upset easily. If the maternal attitude under affectionate, there will be emotional detachment and neglect. Emotionally distant, not very loving or involved mother, and the child might be well behaved but emotionally fragile, may cry easily and resist cooperation. So the child may behave well but is emotionally sensitive. They might cry easily and not cooperate much. If the maternal attitude is rejecting, then the mother might over neglect and give punishment. So she doesn't want, the child may punish or ignore them. The child might be aggressive, overactive, disobedient, seeks attention through disruptive behavior. If the maternal attitude is authoritarian, the mother might rigid, discipline, non-love oriented control, very strict, use punishment to control behavior. Child might submissive but evasive, avoid direct disobedience but may resist indirectly. So child may follow rules but secretly avoid doing what they are told. They might not openly misbehave but still resist in quiet. There are some scientific evidence which supports the maternal influence. Landry et al. 2000 concluded that maternal engagement at age of 2 to 3.5 predicts independent cognitive and social functioning at 4.5 years. Hen and Fox in 2006 concluded that maternal sensitivity influences infant stress responses and social ability. Maternal interactive quality influences infants' psychological and behavioral stress response, including fearfulness and social ability. Hen in 2008 concluded that maternal negative negativity predicts poor social functioning in withdrawn children. So, Hen emphasized that maternal negativity correlates with poor social functioning in socially withdrawn children, while positivity improves outcome in temperamentally shy preschoolers. Mukhopadhyay et al. In 2016 concluded that maternal dental fear influences child cooperation and temperament. So, Mukhopadhyay et al. Showed that children whose mothers had negative past dental experiences were significantly more likely to exhibit uncooperative behavior during dental visits. And Tribhuvanan et al. In 2021 concluded that positive correlation between maternal and child anxiety scores in dental settings. There are few neurological and behavioral mechanisms after this role of maternal anxiety. So first is mirror neuron activation. So children may neurologically mirror maternal facial expression and emotional tone, triggering anxiety circuits. Attachment theory: secure maternal attachment fostered resilience. Insecure or avoidant attachment increases vulnerability to dental fear. Cortisol regulation: maternal anxiety can dysregulate the child's hypothalamic pituitary adrenal axis, elevating stress hormones during dental visits. Denotes a state of apprehension that something dreadful is going to happen in relation to dental treatment, and it is coupled with the sense of losing control. In this case, what are the clinical strategies for pediatric dentists? So, to mitigate the impact of maternal anxiety, pediatric dentists should follow pre-visit counseling to educate mothers about procedures to reduce anticipatory anxiety. Parental presence: evaluate case by case. Some children benefit, others may escalate anxiety if the mother is visibly distressed. Behavior management techniques: use tell, show, do, distraction modeling, and positive reinforcement tailored to the child's emotional profile. Empathy and validation: offer emotional support to both mother and child, especially in case of under affection or rejection. These are the references. If you want these as a PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. We also put image based MCQ in pediatric dentistry in our shorts, and we'll put lots of other types of MCQs and topic of the week related to pediatric dentistry. So press the bell icon for every update. Like, share, subscribe. Thank you.